Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. This channel is dedicated to amplifying the voices of doctors, other healthcare professionals, and patients as they share their unique struggles, triumphs, and passions. My mission is to build connection and create advocacy for healthy doctors, driving positive change that benefits both doctors and patients. This is a space for everyone who cares about the future of healthcare. If you appreciate this content, please like and subscribe now. It really helps the episodes reach our target audience. And today I would like to welcome Dr. Apurv Gupta and Dr. Michael Mantell. Thanks for joining us today, Apurv and Michael.
Great to be here with both of you. I'm honored to be on the show with you and with Apurv. So let's dive in.
There we go. Thank you so much for this amazing opportunity. And I get to meet Dr. Mantell for the first time. Fantastic.
Well, this is very exciting, and I can't wait for our conversation. And by way of a brief introduction, Dr. Apurv Gupta's work centers on transforming healthcare organizations, leveraging systems, culture, and technology. And Dr. Michael Mantell is a mental health architect. His mission is helping people disturb themselves less with emotional well being, clarity, and resilience. And he's a speaker and an author. And today we'll be talking about how Apurv's work with a loving organization aligns with Michael's work as a psychologist. And all three of us are passionate about mental health and well being.
Beautiful.
And I would like to spotlight Michael had recently sent me his book, The Link is What You Think, and I'm almost done reading it. So thank you, Michael.
And here's another book I've been enjoying reading right here because Kim was a guest on my show, 360-Degree Health. And Apurv, we're going to have to get you on as well.
Oh,
And
wonderful.
we've been enjoying trading books. So this is great.
Yeah, this is great. I'm so excited. And I usually start by asking what you'd most like our audience to know about you. So, Apurv, what would you like us to know about you?
Thank you, Kim. Yes, I guess with a broad opening like that, I'm tempted to kind of tell you a little bit more about me personally. I've lived in Rhode Island for a long time. My parents immigrated here back in 1981, and so now it's been 44 years. I would never would have thought that. Actually, when I was younger, I always thought of getting away and going to a big city, and then it was only after getting married that I realized, wait, this is kind of nice. It's a nice, small, mostly bedroom community. It's a great place to raise a family. We now have two grown-up kids. One is just graduated from college and now he's off to DC working. And the other one just graduated high school and is now in college. So we're experiencing what we call empty nest syndrome. And as my friends have been encouraging me to think of it as more open door syndrome and to appreciate more the positive side of it, which is newfound independence for all of us, an opportunity to grow and an opportunity to get into things that we may not have been able to get into in the previous phase when we were really busy taking care of the kids. But it's really a joy to just see them maturing and flying the coop, as they say.
Well, I love that. And our daughter went to school in Rhode Island and she now lives in DC. And sometimes I say to her, I can't believe you moved 5.5 hours away from your mother. But it gives us another place to visit. And speaking to what you said, and since I'm in Connecticut, hopefully we can meet up sometime. So,
Wonderful.
and speaking of that, I was recently in San Diego, not realizing that Michael lived in San Diego. So, Michael, why don't you tell us a bit about yourself?
Okay, thank you very much, Kim. Apurv, I love your story. It's great. I really appreciate that. What can I tell you? I met my wife after I moved from Newark, New Jersey to West Orange, New Jersey in my senior year of high school. And walking down the hall, and someone stepped in the back of my shoe and it flipped me forward. And I was with my friend Johnny, who I had just met. We just moved there. And he said, come on, come on. She's a sophomore. You're a senior. And I turned around and I looked at her and I said, oh my goodness, I'm going to marry her.
What?
And a number of years later, we did. And we then moved to San Diego. Our kids were born here. But of course, after they graduated college, they moved back east. So we are thousands of miles from them. I'll just share one quick story about myself. I was like probably 9, 10 years old, and my parents had shoe stores in Newark, New Jersey. My grandfather called me out one day to the curb. He said, look down the street at so and so's shoe store. What do you see him doing? I looked and I see him looking at our shoe store. And he said to me, how many people are carrying bags out of his store? I looked again, none. How many people are carrying shoes out of our store? Quite a lot. What have you learned? I said, I learned that if you pay attention to yourself and your own, the people who you have to take care of, you do better than looking at everybody else in the world. Wow, did that story stick with me? I could
Mhm.
go on, but that's sort of how I got into creating the doctor-patient relationship course at UCSD Medical School, where
That's a great story, Michael. And Apurv, could you please tell us a story about your why?
Yeah, thank you. Appreciate that opportunity. I really love Michael's story. I cannot believe that he figured out that quickly from that kind of an incident that he was going to marry his wife to be. It's sort of like thinking about whether that's fate or whether he manifested that. That's amazing. And I love that story about the why, which is like a childhood story that just stuck with you and guided your career. For me, it's actually been a little bit more recent. I guess I could dig back and maybe find something from that stage too. But I guess my so-called origin story as to what I'm doing now really only started a few years ago. For most of my career, I've been a quality improvement, performance improvement professional, and I've really enjoyed that. Just kind of go in and working with physicians and nurses and health systems on fixing things like mortality, readmissions, throughput, length of stay, quality, you name it, whatever needs to be fixed, hospitalist programs, ED, we go and fix things. So that's how I've always thought of myself. For the last 12 years, I've been a performance improvement consultant with a few different firms. And over that period of time, I gradually came to realize that if we address things at more of the culture level, that is more the engagement and the decision making, and then the communication and accountability, that would make us more successful in our fixing things approach. So we call that culture transformation, and so that's what I've been doing more and more of over the last decade. And then COVID hit. And that's kind of when I had my aha moment. It was like almost like a wake up call for me, where I said, "Well, if I'm so good at fixing things and good at the performance improvement and culture transformation, then why is it that so many of our people are burning out at the same time?" It was more like a crisis of conscience for me, actually, because I felt maybe there's something I'm doing to actually make the matter worse. And so that really sent me into a spin. I've been digging deep into that for many years now. And then a couple of years ago, my colleague Tom Dahlberg, who many of you may know, I think him, and I don't know if you know Michael, but he is really was a great mentor and inspiration to me. He and I were preparing a session for a premier national conference on values-based care, and as we were collaborating on that, we came upon a few organizations that seemed to be doing something differently. They were just taking better care of their own people. In that process, they were finding that the people had more meaning and purpose and joy in their work. And as a result, those people were willing to be more engaging and collaborative with each other. And that's what was leading to amazing outcomes all across the board. Improved quality, improved safety, improved patient experience, even improvements in profitability. And they were doing it not at the expense of their people. So their burnout was going down and their turnover rates were going down. So that was the big aha that Tom and I both had at the time, June of 2023. We said, wow, this is what love feels like if it was in an organization. And so we coined this terminology called a loving organization. And from there, it's really stuck. We went back and talked to those organizations themselves and said, "Hey, this approach that you folks are taking, it feels to us like a loving organization." They immediately stood up and paid attention and said, "Wow, this is amazing. We've never heard of this before. We didn't realize other people were doing this. We weren't following any particular playbook. We love this approach and we love this idea. We want to work with you." So that's where the movement was born. And I guess you'd say that everything that I'm doing now all ties back to this idea of loving organization.
Well, I love that, a loving organization. And I didn't realize it was quite that new because that's actually around the time that I started getting involved in these spaces was that spring of 2023. So I probably met Tom first online, on LinkedIn. And so I didn't realize that I've kind of been following it really since its inception. So
There you go. Right. Yes, we're all part of the movement.
Yeah, well, that's great. So, Michael, is there anything that brings up for you, and anything you'd like to add to what Apurv said?
I will tell you that you've all seen, I imagine you've seen that graphic that shows this doctor carrying a black bag. And I'm not sure if when I saw it or if I made it, I don't remember. But in any case, carrying the black bag, and it says, what's healing is not the patient, is not what's in the black bag.
Mm.
What's healing is what's in the heart of the doctor carrying the black bag.
Oh,
And
beautiful.
boy, did that impact me. And when I put this course together, the doctor-patient relationship course, I originally called it the patient-doctor relationship course. The patient will see you, the doctor will see you now. I like to say the patient will see you now. So in any case, I think that we're saying the same thing here. The idea of being that if we understand that when two hearts touch, that's healing. And we have to get out of our head. The doctor will say to me, "So, Dr. Michael, what are you allergic to?" It says here you're allergic to sulfa. Oh, yeah, but I'm allergic to something else. What's that? Pain? The doctor says to me, "Oh, I'll hold your hand through this." Oh my
Mhm.
goodness, that's so healing. So I think that what we have to do is, like you're saying, Apurv, get into this notion of what is genuine care. Head space, heart space, they're braided together. And the only place they're separate are in textbooks. But thankfully, even there, they're braiding together.
So beautifully said. I love how you express that.
Absolutely. And we know what the problems are in the systems today, right? And as our Pooh mentioned, that there are organizations and places that are making a difference. So I really want to spotlight and amplify, and that's one reason I was having you both on, like healthcare leaders that are doing it right so that this can be replicated. So Arpur, tell us a little more about a loving organization and how you think we can spread the word and help that move forward.
Thank you, Kim. Thank you for this opportunity. And it really is glorious to be in conversation with you and Michael. It's just like amazing how this is unfolding. Michael, I love your point about the doctor-patient relationship or the patient-doctor relationship. And I guess where the loving organization piece comes into that is to say that the organization, that's the clinic or the hospital or the health system that's around the doctor, needs to also have their role in creating the right environment, especially in these days. Back in the, early halcyon days of medicine, it was really the doctor carrying the black bag, going to visit the patient, and it was a very individual sort of an operation. And now we have big behemoth systems and hospitals and corporatization of healthcare. Well, we still need to deliver love and compassion. And I think what we're recognizing now more and more over the last several decades is that there's a role that the clinic and the hospital and the health system need to play in creating that loving environment. So that's sort of where loving organization comes in, is sort of taking the onus from the shoulders of the physician and the nurse who are delivering incredible heroic care each and every day. We're not asking them to be more loving. They're already plenty loving, and people don't go into healthcare if they're not loving. The unfortunate thing is that over the course of time, during medical school, nursing school, residency, fellowship, and then just work, somehow that compassion gets a little bit beaten out of us. It gets lost, and that's kind of when we become at risk for burnout. That's happening because of the systems that we're operating within. And so we're with the loving organization, we're trying to put the focus back on those systems. And we're trying to say to the organizations, hey, you can have your equal share of the responsibility. Certainly Dr. Gupta and Dr. Mantell need to have their share of the responsibility in being loving and compassionate when they're meeting with patients. But what can the system do to ensure that the policies are loving, that the workflows are loving, that the culture is loving, the technology is loving? So there's all these things that kind of come around that patient-doctor relationship that help to support the love. So I wanted to make that connection and then maybe turn it back to both of you and see how you would build upon that. Dr. Mantell, it seems like Michael probably has some ideas that he
Well,
wants to jump
I'll
in.
just add to that. Oh, I just got finished doing some consulting to a hospital, and I said to them, listen, If every patient here lived the 6 pillars of the American College of Lifestyle Medicine, healthy living, every one of them perfectly, which no one does, but you know what I mean. We really lived it, but we did it in an environment filled with dirt, filled with noise, filled with all kinds of disruption. Those 6 pillars of healthy living would not mean a whole lot. So we have to understand
Mm.
that the mind and the body are braided, but the system and the physician's heart and caring, hers or his, are braided together. It isn't about it's your fault. No, it's your fault. No, you don't care. No, you don't support. No, you don't. No, it's one. And where some physicians are saying goodbye, I'm leaving this. I'm going to concierge healthcare. But I tell them, but if the person who answers your phone says, "Hi, hold on," guess what? That's not helping the patient either.
Mhm.
So I love what you're doing, Apurva, and I'm going to be digging more into your organization to learn more about it. But I think you're right. We are one. We can't be separated.
That's fantastic.
And I think that was a beautiful analogy speaking to a loving organization, right? It's like the doctors and nurses can have their heart in the right place, but if the system doesn't support that, nobody's going to be cared for the way they need to be, the employees or the patients. So, Proof, can you share a success story?
Yeah, absolutely. Happy to. I love the success stories. Actually, that's what got Tom and I down this pathway, which has now become a movement. We're now a not-for-profit consortium, which you know, Kim. I don't know if you realize that, Michael. We have about 75 active charter members. It's growing. We have doctors, nurses, therapists, pharmacists, people from all walks of life that are participating in this movement. Leadership experts, burnout experts, IT experts. There's a lot of interest in wanting to create the right system. So it's really been amazing. And one thing that's really propped us up, Kim, to get to the point of your question, is that we're basing it all on the success stories. Those 3 or 4 organizations that Tom and I identified 2 years ago has now grown to 10. We call them our exemplars. At that point, really one of the key organizations we identified that really gave us a lot of confidence and courage is University Hospitals in Ohio. It's led by Dr. Peter Pronovost, who's a real luminary in this space. He's a great advocate for what he calls living and leading with love. And he's taught that to his entire board and his C-suite and everywhere. And so he's basically, helped to convert that university hospitals into that loving approach. There are others too, which is maybe interesting to the listeners that didn't realize that these organizations are out there because they're not small mom and pop shops necessarily. They're actually pretty big, decent sized health systems. There's Baylor Scott and White in Texas. There's Advent Health in Florida, Hackensack Meridian Health in New Jersey. St. Luke's University Health Network in Allentown, Pennsylvania, University of Louisville Physicians Group. So I could go on. I mean, some people say to me, we have thousands of health organizations. You've only found 10. And I say, well, at least we found 10, right? Because with the 10, they're onto something. They're already doing this work. And I just want to be clear, we did not get them there. They got there on their own. We're just good consultants and good observers and good listeners going in retrospectively, observing what they're doing, and being inspired by it and admiring it, and then studying it, and then trying to develop some kind of a common thread and methodology across it so that we can all learn from each other. So I don't want anyone to misunderstand thinking that we've created these loving organizations. No, we found these loving organizations in nature. They were just out there doing their own thing. The commonality across all of them that's really struck us is how they have taken the responsibility to be loving on their shoulders at the organizational level and not by thrusting it back on the individuals and expecting their doctors and nurses to somehow become more empathetic and compassionate. Certainly, many of them do provide courses in empathy training and compassion training and generally in well-being like mindfulness and yoga. But they're also willing to take the responsibility to say, we can look at all the different systems of the organization, like leadership, or like policies, or like workflows, and we can make each of those systems more loving. So I don't know if that's an in-depth answer to your question, Kim, but at least it's a broad answer to your question that we've got a great number of organizations to be inspired by.
Yeah, well, that's great. Well, anything Michael would like to add, and then also, Michael, your book. So basically, systems are made up of individuals, right? And everyone has their own mind and their own brain, and your book is related, the link is what you think. So anything you'd like to add to what Dora Proof said and how you would relate your book and individual minds into this collective of culture transformation?
Right. Well, I refer to myself as a mental health architect. I don't call myself a psychologist. I sort of retired from that a number of years ago. I do more mental health coaching. And in terms of what Apurv's saying, you find these organizations that are doing great work, and you come in and you add your seasoning to it, and you grow together. You know that every day, except on Saturday, I publish what I call the Mantell's Points to Ponder. My passion, I give it away in the media and in wherever I can, is to help people disturb themselves less. And I noticed that when Kim was saying that, again, she's smiling because it's sort of a cute way of saying, "What are you driving yourself crazy for?" That's the way I was raised. My mother used to say, "What do you care? Stop driving yourself crazy. You're talking it into yourself. You're talking it into yourself." Little did I know that she was a cognitive therapist. She really wasn't, but boy, did she lay the framework down. I teach, so I was going to say this. When I work with a physician and coach a physician who's having distress of some kind, and that physician then says, "Can I refer some of my patients to you?" Boy, oh boy, that is a success story. That to me really touches me. And I have a mnemonic that I like to share. It's called brave thinking. And let me just go through that quickly with you. B stands for believing with hope. We have to believe with hope. We have to have hope. Hold on, pain ends, but hope, because there's always going to be an answer. What if it all works out? R is reframing the grind. How can we think about this grind in a different way? Maybe this is coming to teach me something. R, excuse me, A, appreciating the gifts in life. If you're a physician, you're a clinician, you have a gift, you have a talent. You're here to help someone's life become a better, healthier life. What are you grateful for? Gratitude, has become the new medicine, at least one type of new medicine. And then V, visualize the good. What is something you're looking forward to today, doctor? What are you looking forward to? That patient, how are you gonna, what's good about that situation? You don't go in and just say, "Oh, you're dying of cancer, you're finished." Of course not. And then we have E, encouragement. How about looking at the strength that you have to help someone else have joy today? Brave thinking. And I like to share that with physicians because it's a great way to start their day. One quick last little tool that I teach. When you go into the patient's room and you close the door, back up and let that doorknob hit you in the back. Why? To remind you, this person is hurting and they look at you as a beacon of hope. Bring that hope. Okay, I'll be quiet.
Beautiful. So, Apurv, if there's anything that you want to add to that, or just share how you feel that we can expand your work and the message to a broader audience, and so more healthcare leaders can find out about it and try to replicate it, and if they're interested.
Thank you. Yeah, thank you. I love, Michael, your brave thinking. Each and every letter of it, it sort of feels like a reframing of CBT
Yeah,
or
absolutely.
learned optimism or one of those frameworks. It's really great, but it seems like almost more holistic and broader. It really speaks to values at the core of it. That's what I'm kind of getting out of it, being brave, and then ultimately being empathetic and being able to visualize. I mean, all of these to me feel like the positive behaviors and values that we need to be able to exhibit. That's really what love is about, also. right? Now, we sometimes get lost in the semantics. Some of us are working on brave thinking, some are working on gratitude, some are working on hope, some are working on kindness, some empathy, compassion. And we know we're connected, but then we're not really connected because we think we're working on different things. And so I guess, Kim, your question to me feels like it's an opportunity, almost like for us to see beyond that and to see what's connecting us. How are we all working on the same thing so that the language and the semantics don't wind up becoming a barrier, and that we're actually able to overcome those in our reframing, as Michael is trying to tell us, in thinking, optimistically and positively. How do we get to that point and realize the commonalities of our work? Because if we actually did that, I think we have some phenomenal people working in this space. We're just not uniting, I think, in the way that we could and to tackle this issue because we kind of, again, we think we're liberated by working in these spaces, but then we get bogged down by working in those spaces. So I would say we should take Dr. Mantell's advice and really think about how do we open up our thinking so that we can actually connect the dots across all of us and embark on this way work in a way that can really make an impact.
Yeah. Beautiful, beautifully said. A simple, first of all, I studied with Marty Seligman, positive psychology, and of course Albert Ellis, who created who's the grandfather of cognitive therapy. So you picked up on that. But I use a simple question, Apurv. When I find myself distressed, I don't look there. I look here. What am I thinking that's making me feel this way? I'm not blaming. I'm taking responsibility. What am I thinking that makes me feel this way?
Love that.
I love that. And Michael, if people want to find out more about you and what you do and how they can get in touch with you, what would you suggest?
Ask my wife. No, I'm kidding. I'm kidding.
On a good day,
We've
right?
been married. We're celebrating 54 years coming up next month.
Wow.
So in any
Congratulations.
case, real quickly, I'm on LinkedIn, Facebook every day. I post many times, all kinds of little tidbits. My email address, I welcome people to contact me directly. drmantell, drmantell at me.com. Write to me. I'll get back to you right away.
That sounds great. And Perv, any last messages for our audience and how can our listeners find more about you and a loving organization?
Thank you. Yeah, thank you, first of all, Kim, for this hosting this. And Michael, I just have loved being in conversation with you. Other people have probably told you this, but it's just striking me, so I'm going to say it. It's amazing to me that you met your wife through a shoe incident, and then that story that you shared earlier was about your dad's selling
True
shoes.
story.
I just
Right.
wonder what the shoes have to do
I
with
know.
you and your life. And maybe, I don't know, there's more. I don't know if there's more shoe stories in there. So there has to be some connection.
I
So, but
love
I
it. I
appreciate
love
that.
Yeah.
I appreciate that what you're sharing with us. It's just amazing. It's very deep. Kim, I would say thank you for hosting us. I hope lots of people get to listen to this. For to find me, I'm very active on LinkedIn, so please look me up. I think it's Dr. Apurv Gupta on LinkedIn. And otherwise, we have a website that we just relaunched just this week, thanks to our great colleagues, Dahlia Haroon and Catherine Stokes. So that's www.alovingorganization.org. alovingorganization.org. So please look that up and check us out. Join the movement where we would like to have more people become part of this. This needs to be our movement. So join. And if you're feeling inclined, please make a small donation because we're not for profit. So we appreciate that. And then to reach me, you can reach me at Apurv at APURV, Apurv at alovingorganization.org. And would love to hear from you and would love to see you participate in this movement.
Well, thank you so much because I love spotlighting things that are going well, that we can amplify and share with other people, and we will all make a difference together. So, thanks again for being my guest.
Thank you very,
Thank
very
you.
much. You're a wonderful host. I appreciate being here, especially with such an esteemed guest. Apurv, you're terrific. I love the website. I've already been on it. It's great. I,
Awesome.
I
Thank
want
you.
people to go to it and get involved and support this organization. It's exactly what we need.
Thank you so much for that support. Really means a lot.
Yes.
Hopefully we'll connect more. This is the beginning of the conversation and we'll
Yes,
keep talking.
exactly right.
Yes. Thank you, Kim, for being such a great connector.
You're welcome, and that's part of it too, is just connecting. Often when I have guests on together, by the time I press stop record, they're already emailing each other, and that fills my heart because that I feel like connection and action are two words that are really resonating with me. And my word of the year is impact. So if you put all of that
Absolutely.
together,
Yes.
connecting each other, putting some action in there, and we'll all make a big impact. So, uh,
Fantastic.
so
Totally
in
get that.
closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.